you so much for taking some time out of your day to join us. I'm Carson Parker. I think I know most of you, but for those that I don't know, I am a therapeutic educational consultant based here in the Indianapolis area and have worked with Rebecca for a little while now and got to talking about some different topics that they focus on at New Vision Wilderness that could be very relevant for therapists and clinicians here in the Indianapolis area. So originally we were going to do it in person. We were going to have lunch, but obviously with everything going on, we made some adjustments. And so are doing this Zoom call and recording it for future reference for folks. But just wanted to say thank you for coming. Thank you for attending. For those that are watching later, thank you for taking some time out of your day. And Rebecca, I will hand it over to you.
Sure. So my name's Rebecca Doyle. I'm a licensed clinical social worker here in the state of Illinois. I currently work in admissions for New Vision Wilderness in Northwoods, which is a trauma-informed, attachment-focused wilderness therapy program. And my background is human development, family studies, and then trauma and attachment. So part of the way that this got started was that Carson had a chance to come up and visit us at NVW Northwoods not that long ago. And after having a chance to immerse herself in some of our modalities and some of the experiences that our students have, she said to me that one of her biggest takeaways was that she now understands we provide trauma-informed care to everybody. And I said, yes, we do. So we decided to get together and talk a little bit about why that is. I have some slides that we can go through to kind of walk you through some of the basics and give you just a little working knowledge of trauma, what it is, and kind of how it all functions together. But then really want to shift the conversation to talking about these greater paradigms in healthcare and how we are where we are, how things are changing and where we might be going, and then also make a note about how that's related to where we are in this current very interesting moment in time in the middle of this global pandemic. What does that mean for all of us? So I'm going to go ahead and share my screen. So some of you may be trauma experts. This is super basic. Over the years, I have found ways to kind of drill this down and give me very usable language to work with families and work with folks who have no training in trauma, just again to give them a point of reference and help them think about how these different things are working together. So the reason that we provide trauma-informed care to everybody is that trauma is actually a universal human experience. Or as my mentor likes to say, we are all survivors of something. So what does he mean by that? What we're really talking about when we reference trauma-informed care in its most basic sense is that we're working with the brain-body-behavior connection. And that's it. So we just have to understand a little bit about how that goes. So trauma is not an event. It's actually the brain and body's response to an event. And we're actually talking about it's the brain and body's response to stress. So the event could be acute. It could be something that you experience just one time. It could be stress that you experience over a long period of time. And also, as a lot of our experts like to remind us, trauma is complex and nuanced. And so we'll get to what that means a little bit as we keep going. So again, when we're referring to trauma-informed care, we're really talking about the brain-body behavior connection. The name trauma-informed is a little bit of a misnomer. And as things evolve, I think we're going to move away from that so that we're just talking about basic care. We'll get back to that too. So trauma-informed care is based on two fundamental foundational practices. And the first is neurobiology, so the brain-body connection. And the second is attachment science, so the relational space in which we develop. All human development takes place within the context of relationships. So what we know is that relationships impact the structure and the function of our brain and nervous system. So when you think back to some of those early caregiving relationships, we now know through a lot of studies that they have profound impact on how those things come together and ultimately how the brain, body, nervous system, how they all communicate. So if you really want to dive into trauma-informed studies and care, there's a ton you could learn about neurobiology, a ton you can learn about attachment science. But I think the most important principles, and again, just easy to remember as you need to pull them forward, is to think about the brain in two parts. It's obviously a lot of different parts of the brain, a lot of different cross-communicating that happens. We like to think of it most simply as your back brain and your front brain. So your back brain is what houses all of your basic survival functions. So most importantly, those are the parts that keep your body breathing, they keep your heart beating. There's some other functions that are pretty vital, but those are the two you absolutely need to have working in order to stay alive. The front part of our brains is more of the intellectual capacity. So that is things like learning, planning, logic, and probably most importantly, language. All of that sits up here in the front, and back here is survival. So there's a lot of different ways to study the shape of the brain and how it communicates. Dan Siegel has a wonderful hand model that a lot of people like to use. I like to use Dr. Vander Kolk's mohawk of the brain analogy using this light switch example. So the way he likes to talk about it most simply is if you can imagine that you have a light switch here in the middle of your forehead, and you have a second light switch back here at the bottom of your head, there's generally a good flow of communication between the two. And so he calls that the mohawk. It sits right here in the middle. It's a good channel of communication. In a relatively well-adjusted, healthy person, you've got all the different components kind of coming together, staying integrated and synchronized, and things are working pretty well. What's most important to understand is that when this back switch is on, your front switch is off. So what does that mean? The brain's most important function above anything else is to keep us alive. And so it's going to divert all attention, energy, planning, anything that it can do is going to be diverted to the back brain to make sure that we keep breathing and that our hearts keep beating. So what happens is the back part of our brain also kind of holds this section called the amygdala. It kind of functions like a smoke detector. Whenever we encounter stress that is interpreted as a potential threat to our survival, the back brain is going to kick on. And so all the energy goes back here, and it really doesn't make this chain. It stops to make sure that survival is the priority. And we're not bringing on logic, we're not bringing on language. This is essentially on pause. And that's really important because when we are working with people who are distressed, dysregulated, really having a hard time, we need to remember that all the logic in the world is not going to help them in those moments. They have to re-regulate and calm this back brain down to be able to come forward and think about what their experience is and potentially choose a response to those experiences. Where it gets kind of interesting is that we all encounter stress. So stress has the capacity to disrupt this great communication. Again, the nervous system is always on the lookout for potential threats to our survival. And so all of our energy is going to go back there when those things show up. When there's chronic stress over time, the brain and body never quite get back to that place of rest and rejuvenation. It's always on alert. It's always kind of looking for what might be coming next. So when you are in that state, we call that hypervigilance. And it kind of means that you're always poised for something to happen. You might be bracing for something to happen. And over time, it's a really difficult way for your nervous system to be sustained. It's gonna kind of come through symptoms and behavior. So it impacts the development of the brain and body. It impacts the way it's able to communicate. Things get kind of fragmented. So a hallmark of trauma-informed care is we understand this notion of things being fragmented. So we're not kind of having this synchronicity up here anymore. We've got different parts that are attempting to communicate, but it's not as smooth, it's not as efficient. Same applies to how the brain is connecting and communicating to the body. That's where things come together and we start to see that manifest as symptoms and behaviors. That can look a variety of ways, but they're usually uncomfortable and they cause a lot of distress. This is where we have to remember that all behavior is communication. And this can be really hard, especially when you're in the moment, you're working with someone, or even in the moment yourself and you're feeling a lot of distress, but all behaviors of communication. And so when we're working with others, we have to really look for what is the underlying need that's driving the communication to be what it is. The behaviors also tell us a little bit about how well the brain and body are working together. Usually is a pretty good indicator that there are some things not coming together as smoothly as they need to be. So this is the very basic trauma-informed pathway that we keep in mind when we're working with any human, which is that we have this neurobiology, we've got this brain and body that are connected, we've got attachment, which is the relational space in which the neurobiology develops. We all encounter stress, and that impacts the communication that happens. Communication can get disrupted, and when it does, it shows up as symptoms and behaviors. Those symptoms and behaviors, once we see them, if we can intervene and support a client and engage in a healing process, that's going to shift things. But ultimately, the symptoms and behavior all come full circle to impact the neurobiology. There is awesome news, however, for as daunting as that all can seem, and it really can be very stressful. There's good news. Our research tells us that we can actually rewire the brain. It's pretty amazing. We can engage with the body and the brain in ways that we're teaching it new ways to experience and respond to the stress that we encounter in everyday life, as well as maybe more of the acute stress. We can learn to better discern true threat versus old perception of threat. So a lot of the behaviors we see, for example, in the students we work with, they're coming forward because the brain has gotten into this pattern of communicating that a lot of different things could potentially be stressful, could potentially be a threat to survival. So they're having a lot of reactions to basic things that might be really puzzling for us who aren't in their bodies, aren't in their minds. But what it does is it can start to help someone develop that process of discernment and figure out where they actually need to respond versus where they can create some space and maybe ground themselves and respond in a different way. So in that way, it can reduce symptoms and modify behaviors. Then we can actually have lived experiences that are affirming, empowering, and joyful. So the way that happens is best described a little bit by Dr. Sandra Bloom. She talks about how you have to be able to imagine something or sense something before you can perceive it, and then before you can have multiple experiences. So if my body is in a constant state of hypervigilance and that's my norm, then what's going to be really difficult is to have that internal sense of safety, of regulation, and that can really get in the way of feeling empowered and feeling joyful. Those things kind of take over. Your body, again, is in this constant state of stress. So we have to be able to provide them with lived experiences of felt safety. That allows us to engage in healthier relationships. And again, we come back to safety as really being a requirement for this work to happen. That brings us into what I think is really the heart of this conversation. And that is to take a look at the different paradigms of care that we're currently operating within. We're in different places. Not everyone is all completely in one or the other, but it's really important to take a look at and start to think about what we know about how the brain and body work together. We know a lot about now about how human beings, develop and what they need to be well. So quite a bit different than before we had this research to inform us. So the current paradigm that we're predominantly operating in, really the core of that is recognizing that expertise lies outside of oneself. And so what happens is if you go into the office of a doctor or another clinical practitioner, or it could be an administrative professional, a lawyer, a financial advisor, you walk into the space and immediately you're met by a hierarchy. So the dynamic is like this from the first moment that you engage. It's the expert, and then it's you. And the expert is essentially going to say, I know what's best for you. And so I'm going to tell you all the things that I think are best, and I'm going to tell you or direct you what you need to do with those things. That's how you get well, is you do what I say you do, right? So that really imposes some limits to the space that you're in, that you're working with, that you're engaging in. And so the professional really just needs to show up with expertise. They don't necessarily need to bring all of these other elements because, again, they see themselves as, this is my role, I'm coming with the information, I'm giving you the information, and now it's up to you to do the work. The emerging paradigm that we are finding ourselves in really is at the core about expertise being within oneself. And that concept right there changes everything. So when you come into the room of a practitioner who is working from this paradigm, you're coming in as equals. There is no hierarchy. I'm meeting you and you're meeting me, and we are in this space, and we are going to try to have a different experience. We're going to try to connect you with some options and some resources so that you can ultimately make decisions for your life and your wellness on your own. So I'm not coming in saying that I know what's best for you. My role is actually to come in and bring my expertise, because it may be true. I may be an expert in different clinical modalities, in resources, in knowing other professionals you may want to connect with as part of your care team. I can bring that expertise to the table. But I believe and adhere to, you are the expert on you. And in a parent-child situation, by and large, the parents are experts on their own children. Nobody is going to know you better than you. No one's going to know your children and the nuances of what they are and what they need better than you. So when you come into that space, it's much more open. There's not the same kind of pressure for me to take down this information and go do what this person says. It allows me an opportunity to come back to myself and engage with my own process of discernment. So that looks different for everybody, but so much of the fragmentation that can happen during trauma or during stress, when we look at how do we bring that back together in integration, so much of what we conventionally do pulls people out of themselves, and they become out of touch with their primary signals that tell them what it is they need to do for themselves. And because we're so unique and different, we are also complex and nuanced. That's going to look really different. So again, that person, that individual has the best capacity to take a look at those things and engage with that process. So that increases elements for safety, because a professional has to come in not only with expertise, but with some of these other qualities as well. So I listed humility, curiosity, non-judgment. And here's kind of what that means. It's not necessarily easy to do. And maybe as practitioners or service providers of any kind, we're able to do it sometimes. But when we come in with humility, humility is being willing to sit in that very uncomfortable space of believing that everything I think I know could be wrong. Everything I think I know might be best for this client or this person that I'm working with could be wrong. And it's only if I open myself up to that space can I have true and authentic curiosity. I have to want to then know, what is this person bringing into the space? What does their own process of discernment look like? There's only, we have to come in with that curiosity. Without curiosity, there's no discovery. And without discovery, there's no pathway to healing. And so you really have to come in from that place of humility, carry with you some curiosity, be willing also in that place of humility not to judge what comes forward. You may think you know what's coming, and then that person you're working with brings you something totally different. And that has to be okay in the space that we work in. There's a couple of key pieces about that I think are important to put out there. The first is I just want to acknowledge our diagnostic manual for mental health. So many times I wish that we could relabel that as the big fat book of ingenious ways that the brain and body has figured out how to keep you alive. Now, my editor might not like the length of that title, but I think it's really accurate. And when we can shift our perspective and actually look at what's typically labeled as pathology as actually being incredibly useful and even wise, then we start to see things really differently. So students that we work with in our program and clients that you work with, they develop a lot of maladaptive behaviors or coping responses. A lot of times that's what brings them to us so that we can rework that a little bit and give them some opportunities for response that's going to allow them to move through the world in a much gentler way. However, it's really important that we don't only focus on the first part of the word, which is the mal, which is this is bad, this isn't working. And we remember the part that is adaptive. So somehow, somewhere in this person's life journey, they needed this behavior. They needed this method of thinking. They needed these manipulative strategies to move through the world and stay alive. When you realize that, you can step back and truly have some awe and respect for what the brain and body has done to keep this person alive. And only then can we really honor that. It's interesting because we're trying to help our clients get to a place where they don't judge their own experience, where they can separate out the shame from what they may have done, where they can honor where it is they've been and how they've learned to cope. But if we're not working in a paradigm that allows us to do that as well, we're not modeling that for them. We're not holding a space where that's okay and where that's safe. So it's a completely different way of looking at wellness. It's a completely different way of looking at coping. It's holding a different space. And it really just shifts the possibilities for where we can go from there. This just happened actually to me this morning. So we admitted a student yesterday to our program, and I've been in touch with her caregivers. And her caregiver messaged me today and said, hey, there's this really important thing that just happened on our drive to the program, and I wanted to make sure I shared it with you. The student was able to talk about the insight that she has and realize that she has a very, very difficult time asking for help. And we really want you to know that because we want you to understand that that's an issue she's working on, but it's also something she may not know how to navigate. But this particular caregiver told the student that at one point in time, she came across a quote or a saying that you cannot give help to others without judgment if you cannot ask for help without judging yourself. I found that to be pretty meaningful. We currently live in a society, and certainly within a healing paradigm, that's much more akin to what we're calling current. It's much more restrictive. We've kind of found ourselves in this place where even in the greater society, it's no longer safe to just be curious or ask questions, let alone ask for help. That feels like a very dangerous thing to do right now. You either kind of ascribe to one extreme or another extreme. And if you come forward and you question anything, there's not a lot of room for exploration. And so we really have to look at what is it about the current space we're working and living in that's made us kind of function in this way. How do we understand that and get back to this place where we can do the things that we as mental health providers were trained to do? I find this super baffling to me sometimes, is that by training, we were taught how to analyze and critically think about things, whether that's from a clinical perspective, a project management perspective, a supervisory perspective. All of those roles require us to be willing to go into these spaces and ask good questions and make mistakes and be willing to be wrong so that we have the space to come up with creative solutions. Right now, that's not quite the space we're living in on a larger level. And so what we're really kind of looking at is, how do we understand these paradigms and how do we consider moving toward more of what's emerging versus more of what has been kind of historically present and what we're kind of used to. The other key point when it comes to understanding trauma-informed care is that validation is one of the kind of core components of how we help people make change. And so I just wanted to share for a moment that validation is not necessarily communicating that I agree with what you're saying or doing right now. Validation is providing for someone the message that I see you, I hear you, and I understand that the experience you're having right now is what you're going through. I'm not judging that experience. I'm acknowledging that it's there. Maybe down the road in hindsight, you're going to develop a different perspective about your own experience. But right now, this is where you are, and where you are is valid. What you're going through is important and meaningful. And you are worthy enough for me to hold space to consider what that might be like for you. Even if I think the circumstances are different, even if maybe I believe you're overreacting to something, that doesn't matter. We're giving that message of where you are is okay, where you are is where you need to be. And I'm going to be with you in that until it shifts and passes. And so in that we have found is one of the primary ways that we can relax that back brain. When someone feels seen and they have that internal experience, we call it an internal felt sense of safety, as they develop that and that grows, that reduces the activity in the back brain. It allows for some rest and some respite. It allows for this channel of communication to come back together. It encourages some of this integration that might have been fragmented out. And it's really critical to how we engage with people. And so as I was thinking about this today, I realized that validation in the context of hierarchy, which is what the current paradigm is about, validation within the context of hierarchy, it's really pity, right? It's I'm up here and I see this and I see your pain and I see your experience and I'm really sorry you're having that experience, but I'm kind of up here where I can look down and I'm not in that place. I don't have it, I don't experience this. I'll help you down here, but I'm above it. And that can really breed shame, which is the opposite of what we're trying to do here. So it's interesting, I think, for us to reflect a little bit about what aspects of these paradigms do we find ourselves in, not just as professionals, but personally. So where do we encounter some of these elements? And is there an opportunity to shift them? Do we need to shift them? Do we want to shift them? What would it look like if we did or if we didn't? I can say that within the emerging paradigm, that space is what allows another human being to experience true autonomy, true self-determination, and true empowerment. And all those things, by the way, are social work values. So much of this for me as a licensed clinical social worker is really just coming back to the space in which I promised to practice anyway. A lot easier said than done, but we know that this space allows for it, whereas the hierarchical current paradigm really doesn't. And if we circle this back to the science, if we want to go back to our neuroscience, how our brain and body is connected and how that is shaped by the relational space that we're in, we know that we need this kind of relational space in order to facilitate those connections coming back together, in order to process whatever it is that we or students might be holding on to. We need this space to do that work. And so it prompts us to really think about what this shift might mean. So I just wanted to go forward for a minute and also acknowledge that we're in this really interesting space in the middle of this pandemic. We have a unique opportunity at this moment in time to really think about what pre-pandemic life was like and where we might be going in post-pandemic life. So right now, the entire globe is having a shared experience, which I'm not sure that we can reference anything quite like this, at least in our lifetimes. So every single human being on this planet is experiencing this pandemic in some way. A lot of folks are taking a look at what was life like before, because we're now kind of coming to the realization that while things are on pause right now, post-pandemic life is going to be fundamentally different than where we were before. We don't know what this space is going to look like. We don't know what post-pandemic life is going to be comprised of, but we have a chance to really think about what from pre-pandemic life do we want to bring over? What things do we maybe want to modify and bring over? And what elements of life and our societal life and our relational life do we want to leave over here? As I was thinking this through, I realized it hit me hard this weekend that when we get to post-pandemic life, we are going to be faced with an opportunity, if not, it will be forced upon us, that we really are going to have to take a look at our own humanity. We're going to have to re-examine what it means to be human and how we now relate to each other within this shared experience, and how do we want to continue relating to each other, because that can go one of many ways. It's going to encourage us to really redefine what it means to be well, because what it meant to be well as a human being in pre-pandemic life is going to be altered in some way when we get to the other side. So what I realized pretty strongly is that if we are going to do that post-pandemic work, if we're going to allow ourselves the opportunity to really re-examine that humanity, to redefine our wellness, to really co-create what we want this world to be like, it's going to require the emerging paradigm. Again, we know we need that space to be able to do this work. And I now question if there's going to be any room for the old paradigm in post-pandemic life. So I will leave you with that. I will exit out of here. And I'd like to invite Carson to talk a little bit about her experiences with this information and how it's impacted her work. I do have some resources I can come back to for you, as well as our contact information, so you can keep in touch. But Carson,
Okay,
the floor is yours.
thank you. So as Rebecca said, I did have a big shift after participating and going through some of the exercises related to a lot of what you've talked about while I was visiting New Vision. And prior to that, you know, as a consultant, a big piece of what I do is visiting a lot of programs, looking at their different areas of expertise, what types of students you work with, what's your approach, what clinical modalities, what your therapist looks like. So I look at all those pieces and make the best fit for every student I work with. And have worked with New Vision, have had a couple kids there recently. And prior to my actual visit, my mindset was always trauma from the standpoint of a diagnosis, or a very, even if it was like a small t trauma, a very kind of pivotal or identifiable point for the student. And after visiting, I really shifted significantly into understanding that the it's more of an approach versus the diagnosis or label or identifying point that they can kind of easily say, this happened and I've had issues since then. A lot of times they really don't know what has kind of triggered some of the behaviors and feelings and that sort of thing. And so I realized that a lot of the approach is very meaningful in working with adolescents and young adults, which is who I work with. So obviously adults as well, but for my population, realizing that some of the things that you're talking about, Rebecca, the coming in with humility, that understanding that I may not understand exactly what it is you're going through, but I can validate that you're having issues or that you're struggling, and not kind of acting like it's something that needs fixed, but coming in from that approach of that we're equals. And a lot of the students that I work with, again, we're talking about teenagers up through young adults. How often are people kind of talking at them or telling them how they should feel or what they should be doing, right? Like, it's kind of the natural thing as a parent sometimes. And even, their teachers that they interact with, and the ability to sit down and say, my therapist is here to help me and work with me, and they're going to come at me from that equal approach, is really significant. A young lady that Rebecca and I worked with, she's been there for not even a week yet, I don't think, but one of my big things with this particular approach with this young lady was she was clearly feeling a lot of shame about what we don't necessarily know, but she very much operated in a hierarchy at home. And great parents, they were, willing to do anything to help her, but they still had that traditional role of, we're the parents, you're the teenager. And she very much was in that kind of shame cycle. And I knew being able to go somewhere where she suddenly wasn't in that hierarchy, and that somebody wasn't saying, I know more than you know, so let me tell you how it is, she would feel empowered fairly quickly, which would really start to, again, as Rebecca kind of went over the more scientific pieces of that, allow her to move more into healthy living and developing a better sense of herself and more confidence. And so it was really impactful to me, because it helped me see the difference there versus when a student comes into work that I'm working with, sorry, I'm kind of stuttering over my words, that I'm not looking for somebody with trauma, that I'm looking for who can benefit from this approach versus who has an identified big T, little t trauma. And so for me, I think that was really, really impactful, and has even helped me from the standpoint of when I'm talking to families and interviewing the parents and interviewing the students, of really trying to take it from that side and let them know, that I validate, how they're feeling. I had a mom ask me yesterday, she has a son who isn't quite bought into the idea of getting help yet. And her question to me was, how do you get these kids that come to you that don't really see how significant their issues might be, or that they really need help? How do you get their buy-in? How do you do that in a short amount of time? And, the biggest thing I said to her was, look, what's really important is that these students, regardless of their age or regardless of what's going on, that they know that I'm here to hear what they have to say, and that I actually listen to their perspective. And what mom and dad think is going on may be very different. What mom and dad report as their things that they like to do may be very different than what the student themselves say. They'll sometimes say to me, yeah, I haven't liked to play piano for 3 years, but my parents make me and they think I love it. And, all of those things that I actually just listen and hear them and give them a voice and let them know, look, you may not go into this rah, can't wait to go to this program, but I want to make sure that you are at least at the point where you're, one, comfortable and really understand the goal on the back end for you, but also to understand that I'm hearing what you're saying and I'm definitely taking that into account. And, when I'm identifying programs or when I'm looking at different therapists, and just being heard and them being able to come in as the expert on themselves. And I love, Rebecca, at the beginning, you said parents are the expert on their kids. I say that all the time to them. I have my own area of expertise, and you're the parent of your kid. Nobody knows my kids better than, I do as the parent. So giving them that opportunity to talk about their child, giving the child or young adult an opportunity to talk and have a voice and explain what's going on for them, instead of saying to them, this is what you should be doing, this is what you shouldn't be doing. So that, for me, I think was really, really helpful. Just kind of that takeaway. And that's kind of how we started talking, Rebecca, was obviously trauma-informed care is something that is talked about a lot, I think, here kind of more recently. And kind of taking a step back and looking how it can be applied, or the kind of principles or takeaways that can be used in everyday practice, whether it's as a therapist, as a teacher, as a school counselor, as a parent yourself, is really, I think, something that is universal. And so I'm really appreciative that you were willing to come on and talk to everybody about this, because I do think it's helpful. I mean, looking at, what's going on right now, I have a 17-year-old, now 16-year-old who turned 16 while we're in quarantine, and an 11-year-old. They're all kind of in their own paths, but my 17-year-old is a senior. And I was joking before we started that I'm just going to keep assuming graduation is going to happen until somebody tells me it's not, because I can't really deal with it. But it's really, I try very hard as a parent to always hear what my kids are going through, not tell them what they should be feeling. And I did make the mistake the other day of my son was really feeling sorry for himself, and he is convinced that he has the worst luck. This is my son who has a full ride football scholarship to a Division I school. He's doing okay. So he's kind of going on about this. He had shoulder surgery, some different things. But again, the kid's doing really well. And I made the mistake after affirming what he was feeling, saying, I know this is really hard. I'm sorry. I don't know what you're going through. I've not had to go through that before. I then finished and made the mistake of saying, but we should be really grateful. There's a lot of other people in worse situations. And as soon as I said it, I was like, Carson, come on, like rookie move. So of course that didn't go well. And I was like, that why would I do that? He's 17. He's not going to think globally like I would at 40 something. So, even as a parent, I think those pieces are so, so important. So I'm kind of going on and talking a lot, but that was sort of my experience. And so, just to take away as not only a therapist and a consultant or an educational consultant as a parent, but just knowing that was a really kind of interesting and impactful kind of understanding for me.
Before we open it up for questions quickly, I just wanted to mention, so along those lines, Carson, I always tell people, I have a son who's 9, and my hope and wish and dream is that by the time he reaches adulthood, that we are no longer talking about trauma-informed care, that we are simply talking about care. Because we will have taken everything we know about how the brain and body work together and what we need in the space of relationships to be able to be well. And we will have shifted our paradigm and be including that knowledge in all of the approaches that we take. I also wanted just to make a note, I'm part of this movement called the BHAG. And if you look up Help the BHAG on Google, you'll see it. It's a movement for everybody. So all professionals or groups, or you can be a clinician, you can be a parent, you can be anyone who's interested. We are in this movement to try to take the all-time high rates of depression, anxiety, and suicide among young people in our country down to all-time low rates by 2028, which consequently is about the time that my son is going to turn 18. So we've got our work cut out for us, and we really need everyone's ideas and thoughts and energy and creativity and ingenuity, because especially now that we are looking at some post-pandemic life that we can't even identify, I have no idea how that's going to trend for our young people. And anyone who's interested can hop on and sign on for updates, because I'd love to stay connected with you all that way. And then I thought I had one last thing. Oh, just an acknowledgement that, we take this global approach to our work at New Vision, and that keeps us in a space where we can adjust. We can adjust to the needs of the students as they're able to show us those needs. So it's been really, really rewarding that way.
And also, one thing I want to quickly add is I know we're recording, so I know there's a lot of people that are planning to watch it after the fact as well. So if there are questions that come up, feel free to reach out to Rebecca, to myself, or comments, and we can kind of share it within the group.
So that is our current contact information. You can also find us on Facebook and LinkedIn. We like to stay connected to folks that way, both through our business pages, but also just individually. Certainly reach out. And there are some resources for you. So Dr. Russell Vanderkalk and Dr. Peter Levine are great if you want to learn more, take a deeper dive into the trauma aspect, how the brain body works together, how that generates behavior. If you have a particular passion, like I do, about taking these clinical principles and applying them to administrative practice, so that we have comprehensive policies, procedures, organizations, communities, ultimately working toward a healthier society, Dr. Sandra Bloom is a great person. Restoring Sanctuary is a go-to book. And then also there's Braving the Wilderness, pun intended, by Dr. Brene Brown. And that book I love because it really highlights this very odd black-white dichotomous world that we're living in, where just our means of expression have been really stifled, and it's no longer safe to ask questions. And why did we get to this place? And how do we do it differently? How do we approach things with curiosity and not judgment? How do we not feel so defensive, like we have to be experts in everything? So that is a fantastic one. And then for hands-on resources that you can actually use with other people, your clients, your students, your families, NCTSN is a great place to go. They have a lot of pragmatic tools for how to talk to students or families about certain things, how to talk to them about pandemic, what tools they might need to help cope with pandemic. So there you go. Those are our resources. Thank you so much for joining us, everybody.